Myotonia versus paramyotonia. Myotonia and paramyotonia are seen in few genetic conditions which presents with muscle stiffness. Myotonia is characterized by muscle stiffness due to delayed relaxation of the skeletal muscles after voluntary contraction electrical stimulation. Myotonia is the defining symptom of many channelopathies like myotonic dystrophy, myotonia congenita and other myotonic disorders. Clinically it presents with muscle stiffness, pain, etc. The typical location of stiffness varies depending on the underlying disorder but commonly seen in the eyelids, mouth, hands, and proximal legs. Myotonia can affect any muscle group and typically has improvement of stiffness after repeated use of the muscle. This can be demonstrated clinically by several methods. 1. Grip myotonia. 2. Warm-up phenomenon. 3. Percussion myotonia. First, grip myotonia. Grip myotonia is the inability to quickly release a tight grip after holding for few seconds. Here the lady is requested to squeeze the finger for few seconds and then release quickly. Note the difficulty in quickly releasing the grip. This is called grip myotonia. Myotonia improves on repeated contraction of the muscle. This is known as warm-up phenomenon. She was requested to repeat the process few more times. Now, the release of grip has started to become easier. This demonstrates warm-up phenomenon of myotonia. Warm-up phenomenon is the improvement of myotonia after repeated action of the muscles. This is a feature of some conditions with myotonia like myotonia congenita and myotonic dystrophy. Sometimes, there will be paradoxical worsening of difficulty in releasing the grip on repeated exercise. This is a feature of paramyotonia congenita. 3. Demonstration of percussion myotonia. A localized contraction of the muscle that persists for several seconds after percussion is known as percussion myotonia. There is persistent abduction of little finger. This gentleman has myotonic dystrophy. Myotonia can also be demonstrated by direct percussion of muscle and demonstration of persistence of a depression or pit at the site of percussion. On percussion the belly of the muscle, myotonia can be elicited that lasts for several seconds. Note the depression/pit formation at the site of percussion. People with myotonia congenita have hypertrophy of muscles. In Thomson disease, an autosomal dominant variant of myotonia congenita, there will be generalized hypertrophy of muscles giving rise to a Herculean appearance. Also note the profound calf hypertrophy. This gentleman has myotonia congenita. His symptoms improved with phenytoin. 5. Direct percussion of muscle may elicit hung-up reflex responses. Note the hung-up finger. 6. Examine for worsening of myotonia with cold exposure. This is to find out another condition causing muscle stiffness, called paramyotonia congenita. Paramyotonia is the paradoxical worsening of muscle stiffness after exercise and cold exposure. It is seen in paramyotonia congenita. To summarize, features of myotonia include grip myotonia, warm-up phenomenon. Features of paramyotonia includes worsening with exercise and cold exposure. Thanks for watching. Subscribe to Neurology Made Interesting for more.